Good evening to everyone, and welcome to NMP Talk Show, the show that keeps you informed and well engaged with topics about mental health wellness. And we took a little bit of a break, and we're happy that we are back this evening with you to come and discuss topics that affect your mental health wellness. And I'm not alone today. I'm with a special guest who's going to help us expel the myths that are out there that, you can't really talk to registered counselors. They're not qualified to help you with mental wellness issues. Maybe you can speak to psychiatrists or professionals like those. But today, we're going to hear a different story, why we can still speak to them, how trained are they? And to better explain that topic for us is Ms. Tozama Nkonki. Welcome to our show, Sister.
Thank you so much for having me.
Yes. We've been meaning to have you on the show, and we're happy that it finally happened, eh? So, we're talking about registered counselors, and you're one of those. You're a registered counselor, and in your profession, you've been speaking to a lot of people, helping them with their mental health issues. And the reason also we invited you today is to help expel the myths that registered counselors, are not that qualified. So what is your take on that?
Well, registered counselors, in order to qualify to be a registered counselor, you need to have a bachelor's degree in psychology and then do honors. And after you've done honors, you then write a board exam. When you pass the board exam, then HPCSA allows you to train as a registered counselor and to operate a private practice. So they are qualified. It's not just people who do a short course and then they call themselves registered counselors.
Okay. So it's really an intense training that you go through, eh?
Yes, and you have to do an internship for a year.
Okay.
Then after that internship, you write a board exam. So that internship should be approved by HPCSA.
Okay. So we can rightfully say you are qualified, you've been approved.
Yes.
So after the show, people can come to you and say, Sister, I need your help. Please listen to me.
Yes, they can.
That's nice. So what is a registered counselor? I know you spoke about the training that you have to go through, the accreditation. What is a counselor? What is their purpose?
A registered counselor is to see people who have issues in their lives or challenges. And people assume that when you see a psychologist, you are mentally unhealthy. But it's not like that. It's like just somebody who goes to see a doctor. And then that person will get healed by the medication or whatever the doctor will say to that person. But with psychologists, it's actually a talk therapy. And people have a difficulty distinguishing between a psychiatrist and a psychologist. Can I just explain?
Like myself. Yes, please.
So a psychiatrist is a professional who has trained as a medical doctor, but is an expert in the field of psychology. So he can prescribe medication. But a psychologist is not a medical doctor and cannot prescribe medication. So they are both trained to identify medical issues and disorders. And so they are not the same, but at the same time, what they do complements each other, because a person can see a psychiatrist and a psychologist at the same time.
Isn't that too much? You just need one. Or maybe the other, because
it's not too much, because, for example, if I see a person and I realize that this person will need the expertise of a psychiatrist, then I'll refer this person to a psychiatrist so that the person can get medication. And at the same time, this person will not stop coming to me, because with me, the person will talk and we go deep into the challenges or issues that brought this challenge that she is or he is currently facing at the moment.
Okay. So is that the role that you play as a counselor?
Yes.
Okay. All right. So who needs counseling?
Well, that this is a broad, this is a broad thing. Well, everybody needs a counselor, myself included, ne?
Mm.
Because sometimes even day-to-day things can be stressful. I'll just make something simple, like the person who has been married, newlywed. So after the excitement of the wedding and the preparation of the wedding and then the honeymoon, when this new wife move away from the familiar surroundings and comes back, maybe the person moves. I'll make an example of a wife and a husband. So if the new wife moves to the place where the husband is, maybe this place is away from where the husband stays, and then the person comes and stays here away from families, away from friends, away from everything that the person knows. And then that adrenaline rush that she used to, that she had of preparation for the wedding and also the honeymoon drops. And then when that happens, the person feels so lonely because the husband is working and the whole day she's at home, she's still struggling to find work in this new area. Sometimes the person becomes depressed and everybody's wondering, this is a newlywed, why is this person depressed? But when the person goes for counseling, then the counselor can dig deep and really find out that this is exactly what is happening, because it's possible that even the owner, the person who's depressed, doesn't know why she's feeling that way.
You know, you're talking about something very, for me, it's something that I've never thought about. You know, new surroundings, new environment, and especially for a new couple that is moving away from their familiar surroundings. And I personally, I've seen new wives, even husbands, struggling, you know, in their new marriage. They're not coping very well. But you're thinking, guys, you just got married. This is the
What's
honeymoon
happening?
period. Why are you stressing?
And sometimes it's
Not
something.
thinking that it could be the issue.
Yes. So whenever an individual or a couple or a family is experiencing overwhelming anxiety or stress due to several issues really or challenges, they will seek counseling. And these can vary from unemployment, loss of business or income, loss of a loved one, or domestic violence, or any kind of trauma, just to mention a few things that people deal with. Basically, anything that interrupts your status quo, whether it's negative or positive, can lead to a lot of stress and anxiety. So a trained professional then will allow you to verbalize the issues that you are going through, and without being judgmental. When you go to a counselor, it's a safe place where you can say whatever it is that you want to say, and you'll get the necessary coping skills to deal with those challenges. And what people need to know, though, is that they need to be patient when they go for counseling, because emotions do not go away overnight. So, which means you cannot see a counselor once and say, this is not for me, ne? Because emotions take time to set in and they take time again to be dealt with.
You know, I'm also interested to hear from our audience if they really needed a counselor when they got married or they got into a new situation in their life. Please, if you do have that experience, we'll be happy to hear from you. Please share it with us. And I'm also thinking as well, you also need a debriefing as a person.
Yes.
What is that?
Well, I'm a trauma counselor and also a formal debriefer. So,
Okay.
what happens with debriefing? An individual will need debriefing if this person has experienced trauma. This could be something unusual, unexpected, or shocking. A person can experience trauma personally or vicariously. That means through actions of other people or imagining the trauma. Like maybe you come in where there was a car accident and bodies are just lying there, and that traumatized you. Ne? So you were not involved, but because you saw it. And now, whenever you see TV, people being involved in a car accident on TV, that trauma, you relieve that trauma again. So counseling formal debriefing is done to prevent PTSD, which is post-traumatic stress disorder. For example, a trauma can be maybe robbery, burglary, hijacking, gunpoint robbery, or sexual assault or domestic violence, anything that is horrific. Natural disasters also can bring trauma to individuals. So when you go for formal debriefing, you actually prevent post-traumatic stress disorder. And formal debriefing, it's always good to do it from 24 hours to 72 hours. So it works better when it's like that because it's still fresh in your mind. You can actually tell the counselor exactly what you experienced, exactly what happened.
So before you try to sort it out in your mind, but no connection with your emotions.
I think there's a question in the chat.
I guess so.
There's a question in the chat room.
Oh, yes. Let's see. Sino says, is it always necessary for a patient to see both counselor and a psychologist?
It depends because, first of all, I call them my clients, I don't call them patients. Why? Because if I say you are a patient, you automatically think you need to be hospitalized, you are sick, you are what. But counseling is done to ordinary people, just dealing with challenges that are just painful for them. Ne? So when you see, counselor and psychiatrist. So when you see a psychiatrist, as I said before, it could happen that what you are dealing with now needs medication to readjust your mind. But at the same time, you need to talk about what you are dealing with so that the medication and talk therapy work together and complement each other. And then that's how you will get well.
Very interesting. If you have any questions, any comments, please, you can raise your hand from Telegram. We do have also audience on Riverside, the platform that we're streaming live from. You can use your chat option there to send your questions or even comments. If you want to relate your story too, please let us know. Have you had any interactions with a registered counselor, or are you needing one? Because you've gone through a traumatic event, or you've seen something traumatic and you need to talk with somebody. So we do have professionals that will also help us in that regard. And for the like of Sis Tozama Nkonki, she's a registered counselor and she'll be happy to help us. After the show, I will share the contacts on how you can reach her and also some emergency numbers that you may need in case there is an emergency that you want to contact somebody to talk to as a profession. Now, we talked about people who are needing counseling. So, and you mentioned a beautiful scenario where people are moving locations, a new environment that they're needing counseling. Are you getting a lot of clients coming to you not relating to the scenario that you've given? Maybe, for instance, they have family issues, they have traumatic events that are coming to you. And what seems to be the common thing, the common thread between the board about this thing that really brings them to you? I don't know if I'm complicating the question there.
Family issues, yes. And also we know South Africa is high on gender-based violence. So sexual assault, yes. So those are common issues. And family breakdown, especially after COVID-19, there's been a lot of problems with families because You know, what I said is that whenever your status quo change, am I pronouncing right? Whenever it change,
Yeah, status
you
quo.
lose that balance. For us to live normally, healthy lives and happy lives, we need to have equilibrium, sort of, in our lives. So whenever there's a tilt in our lives, we are not coping well. So depending on what is tilting us, sometimes you really cannot work well at work or at home, depending on what is happening around you.
And that could also be all right. Before I go to that, we do have Mona Lisa on the chat. If your child goes for counseling, do we as parents have a right to know what was discussed between counselor and child? Very interesting.
The parents,
Is there a patient and
yes,
doctor confidentiality thing going on
yes,
there?
there's confidentiality. And whenever parents want to talk about what we discussed with the child, I will not tell the parents the details of what we discussed with the child. In fact, I'll ask, I'm not a child psychologist, first of all, so I see older children. Ne? So if I've discussed something with the child, and then I'll ask the child, what are you comfortable with if your mother comes in and asks me what we were talking about? Because what I usually say, I just say our counseling session went well. I end there. Ne? So now I ask the child, and the child will say, I'm not comfortable with ABC. Ne? So don't tell my parents about ABC. So I will not divulge that, because then I'll be breaking the confidentiality of the child. And the child will not trust me again if she is going to come, or he is going to come to me and disclose everything. And then I come to the parents and I tell the parents everything. So the child now will not open up to me when we meet again for a counseling session.
But now, yeah, no, I hear you and I do understand it. But the parents have the responsibility to care for the child.
So,
And if there's something like that, a confidentiality going on, how will they improve the situation at home without them knowing exactly what is wrong with the child?
usually, if it's an underage child, after you've done the counseling session, you bring in the parents and you just advise the parents on how to deal with the child. You give them pointers on what to do. But you don't actually say, your child said this and this and that. Ne? Because you discuss with the child what the child is comfortable about, what we are talking about. What can I talk to your parents about it? How about me saying this and this and this? So if the child is comfortable with that, and if the child is in danger, then you will tell the child that, look, I have to disclose this to your parents because of ABC.
Oh, then you're put in a corner there, eh? As a
So
professional.
the person that you are counseling must give you consent to divulge whatever information.
Okay.
But if you see,
But you also have a
yes, you have a
responsibility
responsibility also
as an adult.
because if a
Yeah.
person is a danger to himself or others, then you have to prevent that danger.
Okay.
Ethics allow
Right.
you to do that.
So do you also have sessions where you go to schools? Because this is where now you see a lot of things going on at school. When we were still going to school, we did not experience things that are going on today, where children are stabbing each other. You know, they bring guns at school, they shoot at each other. Is there something that maybe the council, the board, or maybe the government is doing so that they can help children deal with the issues, or even to understand that they need to see
A
a counselor?
counselor for debriefing. Each school, I think each
Mhm.
school has got a counselor that is affiliated with that school. I once was called to a school where there was an incident and people needed trauma counseling. It's trauma debriefing. And I went there and I did the debriefing.
Okay.
Because when you do debriefing, it's not like counseling. In debriefing, you do it once, and then after 2 weeks, you come back and check how your clients are feeling after 2 weeks. Then if you see after 2 weeks that there's some who are not coping well, then that's when that's when then you suggest that they start coming to you for counseling sessions.
Right, that makes sense. Okay, maybe another question for you. From Sinose, she says, what age group do you see as a counselor?
I prefer to see grade 10, 11, and 12 upwards. But if I'm
Okay.
counseling a family unit, then I'm open to see all the children that are there in the family, because it helps them if they are being seen by someone, by one person, instead of different counselors. And if
So you have a session with both as a family or
individually,
individually in the
I
family?
have a session with them
Okay.
individually, and then whatever consent that are there, I'll just relate to the mother, as I've explained earlier. But at the same time, when I see that the problem that these children are having, they need a child psychologist, then I'll refer them to a child psychologist.
So let's skip to the workforce, not the workforce necessarily, for lack of a better word, the workplace. Yes, maybe that's the word I'm looking for. Because it's also happening in the workplaces where counselors are really needed. People are going under stress because of workload or work conditions, or even their problems back home, but then they're bringing them to work. How does counseling help these ones from a work perspective?
Most workplaces, they've got employee wellness therapy that they have. Most of them, they have psychologists that are affiliated with them. So they will put you in their database,
Okay.
and whenever someone in their work needs counseling, they will then call you and arrange you to contact them and do counseling sessions with them. And some
I
workplaces,
really appreciated.
they actually pay for their workers to come for counseling sessions.
Okay, wow, that's good. That's something that I also appreciated when I used to work full time. We were even given a toll-free number to call in. When you have issues, you want to discuss about work, about your family, about life, anything else. Sort of like an emergency number to call upon when you're stressed. Now that leads me to another question. What is the impact of stress and anxiety that you have come to notice when you're giving counseling?
Stress is an internal reaction to external stressor or stressors. Ne? So what stresses an individual might not stress another individual. So we stress about various things in our lives, and that is normal. There's nothing wrong with that. But at the same time, when we experience stress that is overwhelming, unhealthy stress, if I might put it that way, then our bodies go through fear. And when you experience this, there are three things that you do. You freeze, you fight, or flight. What does that mean? I'll make an example. For example, when you see a snake, what do? There are three things that you do. Your adrenaline that is pouring in your body will
Yeah.
give you time to run.
Yeah.
You can run, that is flight.
Are you
Or
freeze?
you can fight, meaning you deal with the
Yeah.
snake. Or you can just freeze, because you don't know what to do. So those are things that you do when you stress. So what happens to our bodies, as I've spoken about adrenaline, so the adrenaline pours into our bodies, and we deal with this adrenaline by fighting or running. Ne? So when you've got an unhealthy stress, it's when this adrenaline is pouring in your body, and then you don't do anything about it. That is, you are not in front of something that is that you fear, but you are stressed about something. Then the adrenaline keeps pouring in your body, and then it makes you sick. Or if you've got an illness that you have already, it will alter that illness or make it worse. So when one is confronted with a highly demanding stressor, one becomes overwhelmed by that stressor. And at work or at home, the person begins to be disorganized or ineffective or less productive. And also, it's the same with anxiety, in fact. It's fine to be anxious about something that is going to pass after a short time. For example, being anxious when you are going to write an exam, or being anxious when you are going for an interview. Because what happens to your body when you are stressed? Your heart starts pounding, you are sweating, you also have headaches, or your tummy is running. So no one can have that kind of situation happening in their bodies continually. So obviously you are going to get sick. So now when that happens, then you need to, when you realize that you are always anxious, you've got this thing that is stressing you, you can't sleep, you are lacking appetite, you are just not yourself, then that's when now most people will decide that, look, let me go and see a counselor, or let me go to a doctor, and a doctor will refer you to a counselor.
All right, thank you for that. So as you're explaining that stress and the things that are, you always see a situation that gives you stress. What came to my mind is two professions that I'm really worried about. The police and the nurses. Including the
Yes.
doctors. Do they go for counseling? Is then
Well,
you know
with police,
yeah,
with
yeah,
police, that
please.
is SAPS, and
Yeah,
other department of police. I know
yeah.
for a fact because I did my internship at SAPS. They do have an employee wellness
Okay.
program, but members
Mm.
are reluctant to go for counseling because it's our patriotic society that we live in, that men do not cry. Yeah. So because of that, and also the fact that they have got, there was this thing at SAPS that if you go for counseling, you won't be promoted. But it's a chicken and the egg situation, in the sense that when somebody is promoted, there is a lot of demand that is needed to you when you get a promotion. So if you are going through a traumatic situation, then it will take a lot of time, and also it will stress
Lot
you
of time.
more. You are already stressed, you are already seeing a counselor. So until you stabilize, then you get that promotion. So they would seriously suffer in silence and not go for counseling, because they feel that, if I'm known that I'm going for counseling, then I won't get promotion, which to me is not healthy, because your health is at stake. And we've seen so many police committing suicides, sometimes killing themselves and their families, because they do not deal with their stress situation or whatever challenges that they are going through. And yet, in each and every police department, there is an employee wellness program.
Another thing that I'm asking this question is, the other day I was traveling with my wife, and on the highway, I was driving on the fast lane, um, and then I see the metro cop the car is facing me, but it's stationary on the highway with the lights on. So, obviously we'll slow down and then, swerve and change lanes. And I see a body lying on the floor. And as I'm passing there, for me, it's kind of traumatic. And usually, if something like this happens, I would say to my wife, please don't look, don't look what's happening. I'll tell you if you want to know, but don't look. Because knowing that you always carry this image in your brain of somebody who died. And some accidents are horrific. Your members are dismantled, dismembered, and it's not a thought that you want to carry all along. So hence I'm saying, do they get training or counseling for all of that? Because I cannot imagine it's an easy thing, to be a police, let alone a nurse or a doctor that has to deal with that. So we do have a question there. All right, Hilda, I'll unmute you, but let's give our guest an opportunity to answer this, and then we'll come back to you.
So,
Yes, sister?
with
Go.
police, whenever they have experienced a brutal or a traumatic scene, it's mandatory that they must go for debriefing. So they do go for debriefing.
Okay.
As I said to you, that after 2 weeks they must go back to the debriefer so that they are checked whether they need counseling or not. When they come back after that 2 weeks, they will seriously tell you that I don't need counseling. And they will close up because some of them, they don't want to go for counseling. But there are those who do go for counseling. So they are supposed to go for debriefing. So whenever there's a traumatic scene or incident that they've experienced, it's mandatory that they go for debriefing.
Sure. Yeah. All right, Hilda, you can shoot. Can I unmute yourself?
It's not a question. I actually pressed by mistake. My apologies.
Okay, no problem. We do have another question there on the chat. Yeah. Do counselors go for counseling to offload the emotional load from hearing about the difficulties of others? Yeah, Tabata. Yeah, that's my question as well.
To me, by the time I became a counselor, I was already a professional nurse. So other counselors, we used to come and sit together and then offload, just discussing what we've experienced when we've experienced something. But to me, because I was a professional nurse already when I became a counselor, to me, literally, I was so immune to everything that I was hearing because I was used to this situation already. But other counselors who just studied psychology from scratch, they were really traumatized by things that they hear and see. And I was so good with them when I was working in SAPS, telling them how to deal with such situations. So we do come together and discuss what we've seen. If it's traumatic, then you go to another counselor and say, my sis, come, let's have a session, or fellow counselor, let's have a session. And then you have a session just to be okay. Because in order for you to be okay to do counseling, you also need to be okay yourself. For example, I'll make an example. If you've lost someone close, you must seriously cancel your counseling session because you won't be good to anybody because you are also not feeling well yourself. So you should postpone your counseling sessions when you know that you are not well.
You said something there. You said you were a nurse before you became a counselor. So you were immune to such things. I think that's the mentality that other professionals do have, like nurses, doctors, because on a daily basis they see people with X on their heads, in the middle of their heads. They see limbs cut, and they see blood everywhere, and they get immune to that. And then for that reason, they seem to not want to go for counseling because of that. Do you think that's a problem?
Yes, but at the same time, when you are not coping well, then your supervisor will tell you to go for counseling. Because
Okay. So
whenever
at least
there's
there
a
is someone
challenge,
who's
what
looking.
happens is that you are not productive, and people can see that you are not your usual self. And you can also feel that I'm not my
Okay.
usual self.
So
Then that's the time now to go for help, for professional help.
yeah, thanks for that. We do have a hand, Sister Andy. Welcome to the show too. You can unmute yourself. Sister Andy, you can unmute yourself there. All right. While we're waiting for Sister Andy to unmute, we do have another question.
Can you hear me now?
Oh, yes. Now we can hear you, Sister Andy.
Yes, thank you very much, Tozama. Thank you for the input. I would like to ask, do counselors, I won't say psychologists because I'm a counselor, do they become biased at some stage?
We are trained not to be biased, but I'm telling you, there is a bias in the sense that how you grew up will affect how you see things. But there is when you are studying to be a counselor or a psychologist, you are told, you are taught not to be biased, but somehow bias comes in. So you, as a counselor, you shouldn't allow that to come in. In fact, when you feel that you cannot counsel a person, on that first session that you have with a person, you must differentiate whether this person, are you able to help this person, or are you going to refer this person?
Yeah, thank you for your precise your response, because it's not a research, but I personally and other health professionals have noticed that there are psychologists, psychiatrists, and counselors who become biased because, for example, if the father takes their son to a counselor or to the psychiatrist, maybe the father is.
I lost her there.
We also lost it. Are you still there, Sister Andy? I see your name there, but I think your internet is acting up. Okay, while we try to have her back to complete the question, we do have another question, Sino, on the chat. How did your experience as a professional nurse prepare you for being a registered trauma counselor?
The information that I received as a professional nurse made it easier for me to transition into psychology, because already I had learned about anatomy and about most of the curriculum in the psychology field. So to me, most of the things were not new. So it was not as difficult for me as it is difficult for somebody who's just doing psychology from scratch. So it really helped me. And also, when I was also involved with pre and post HIV counseling when I was a professional nurse. So when I studied psychology, for me, I had that information already. And also the fact that I knew most of the illnesses, because sometimes a patient will go to a doctor and the person is diagnosed with just ordinary things like high blood pressure, that is hypertension, or diabetes. And then the person is in denial, and the person doesn't take medication because the person is in denial. So when that person comes to me and say, the doctor refer that person to me and say, this person has got an uncontrolled blood pressure, we've been giving him medication, but the medication is not doing anything, I'm thinking there's something stressing this person. So I'm able now to talk with this person knowing exactly what high blood pressure is and what high blood pressure is doing to this person's health. And then I'm able now to advise that person better than a psychologist who has not done the medical field like I have.
Thank you for that. I think, Sino, hopefully your answer has been, your question has been answered. Another question from Sharon: how does one know it's time to ask for help? You know, before you go on to that, Sister, I actually made a note here to ask the same question, and how I did it is in a form of parents. How do they know that their child needs help? But we can take it with Sharon's
First
angle.
of all,
It's fine.
for parents will know when the child is not okay, the behavior of the child, and also at school they will tell you when the child is not okay, and they will be the ones who said, we think you should refer to an occupational therapist, to a psychologist, to whatever. It's usually the teachers and the parents themselves who see that there's something wrong with their child. Because when a child is stressed, the child will not enjoy the activities that he usually enjoys, and also the appetite as well, and the sleeping pattern will change. Because when somebody is stressed or depressed, or those changes start to happen, the person will have loss of appetite, or the person will eat a lot. The person will have lack of sleep, or the person will sleep a lot. So those changes are easy to see. And also with you as an adult, when you see that I'm now disorganized, I can't focus at work, and my productivity is low, and you can't sleep, you are not eating well, or you are overeating, all those things are changes that happens in your body when you are going through stress or unhealthy stress and unhealthy anxiety. I don't know if I've answered, Sharon. By the way, thank you so much, guys, for the questions.
Yes, please keep them coming. We're also looking forward to hearing comments from Telegram as well. Now, Sister, what is depression?
You know, with depression, people say, I'm depressed, this is depressing. But actually, clinical depression is actually a serious illness. And I always tell people that I talk to who are close to me that mild depression is easy to be reversed than major depression or deep depression. Why? Why am I saying that? Because, as I said before, when you feel that you are not okay, you used to like certain activities, but all of a sudden you are not interested in them. You have lack of appetite, or you are overeating. And when you go to work, you come to work and you want to sleep again, and you have slept the previous night. Or you are literally not sleeping at night. You have insomnia, which is lack of sleep. You sleep early hours or 2 hours, and you do want to sleep, but you can't sleep. So obviously there is something wrong with you. And there is a problem that, or challenge or issue that you are always thinking about it 24/7. Then you must know that there is something wrong with you. So if that is the case, you can go for counseling and then get help. But when you get to major depression, it's a different issue in the sense that people with deep depression or major depression, they say they feel like they are in a black hole and there is no light in that black hole. So when that happens now, this situation, as you remember I said, adrenaline is pouring in your body and your body is being altered by this situation. These hormones that are pouring in your body. So when that happens now, you need the help of a psychiatrist. So a psychologist and a psychiatrist now work together for your own well-being, to get help for you, because you'll go and get medication that will alter the situation that is happening in your brain now from the psychiatrist. And at the same time, talk therapy will help you talk about whatever it is, that issue or challenge that you are going through that is troubling you. So in that way, you will get help that way. And depression is so common Nowadays, a lot of people are depressed. Again, I'm going to talk about our financial situation and also COVID-19. As you know, people lost businesses during COVID-19. Others, they became unemployed. Others, they separated with their partners. Others got divorced. And there was also a change when this happened. Children were taken from private schools to public schools. And something that was also in the news today is that because of the economic situation, adult children are moving back with their parents because of the economy that is difficult nowadays. So you can see that all those things are bringing mental health to the fore, because those are challenges that are going to affect the person who have moved back, because you were so used to being independent, and all of a sudden now you are coming back under your parents' roof, and your parents are going to set their own rules on you, and you are thinking, I'm an adult, but as long as you are under your parents' roof, you are still a child to them. So it's quite a challenge, and it will be a challenge that might lead to mental issues.
Here's another question for you. How can registered counselors help overcome this stigma and promote accessibility to mental health services? Because, like you said, we in the culture of men don't cry. I don't want people to know that I'm weak. Somehow I can't tell my issues. The life of Instagram shows me as somebody who's doing very well, affluent, but I'm dying inside. How can you as counselors help?
We need to take out the stigma that when you go for counseling, you are mentally, you are mad. Let me put it that way. Because psychosis, madness is called psychosis. So psychosis is treated in the psychiatric hospitals, where people need medication, to take medication regularly. And even then, the moment that medication stabilizes your brain, you are able to function well. So, and again, what the men need to know is that when you go for counseling, we are bound by the ethics of our body, the HPCSA, and there's confidentiality there. And also, when you go for counseling, it's a safe environment. And when people go for counseling, they must be honest with their counselor, because if you are not honest when you are telling me your problems, you tell them half-half, I won't be able to help you thoroughly, because I don't know the whole story. You are keeping that story to yourself. You are not opening up. So when you go for counseling, it is a safe environment. So, and I'm not going to judge you. It's not an environment where the counselor is going to be judgmental, but I will be able to assist you, but you need to be honest and be open with me and tell me everything when I ask you what your issues are. Just be open and tell me everything. So I think platforms like these, like now, where I'm in your show, Brana, these are the platforms that are needed for people to get to know that counseling is for everyone, all of us. I think there's a question as well. Again.
Sure. Yeah, there's two questions. Before we get to the chats, let's go to Telegram. Hilda, you can unmute yourself there.
I want to ask this. I once attended a counseling with one lady. That's when I was in school, high school. And this lady asked me to draw a person. And I asked why. Because I don't know how to draw. I don't even want to draw. But she was so persistent. Now I want to know, why do you guys want us to draw something? What do you see in the drawing?
I think she, thank you so much.
Thanks
I
for the
think she
question.
wanted to know what was in your mind, because sometimes you see the situation of a person, especially a child, what's wrong with the family because of the drawing. Because if you ask a child, can you draw me your family? It doesn't matter whether your drawing is good or bad. And the person will draw mother and two sisters. and you ask, you've drawn your mother, where's your father? And then that's how the child opens up and tells you, oh, I don't know my father, or my father is never at home, or whatever. And then the child is opening up like that. Maybe that lady wanted you to open up when she wanted you to draw. I've never asked an adult to draw, because usually adults are able to tell us what's wrong with them or what they are experiencing. And the question there as well, I hope I've answered you.
Yeah.
Thank you for the question.
Yeah.
Thank you so much. No, you've answered me, and that was the last time she saw
Let
me
me tell
because
you
I never went
something
back.
again. When you go to a counselor and you feel that that counselor didn't address your issues, you should not stop going for counseling. You must find a counselor that is a best fit for you. Just like when you go for doctor shopping, if you are moving to a new place, you shop for doctors and you look for a doctor that will resonate with you. And you don't stop going to doctors because you met a doctor that was rude or that didn't understand you. You find a doctor that really understands you. So I think it's the same with counseling. You must find a counselor that will be able to resonate with you, that will be able to answer you, and you'll also feel comfortable with that counselor. The question there, thank you.
Right.
You.
The question now reads, yeah, thank you, Hilda, for the question. Sharon asks, how do we as families and friends support and help those suffering from deep depression or any mental
How
health issue?
the families and also relatives can support the person is treating the person normally, and also listening to the person when the person wants to talk. Because there's a stigma. The moment you you are admitted to a psychiatry, when you come out, people say, oh, that one is goo-goo. I don't know if they use that word, that you are mad. But when you go
Cuckoo.
to a psychiatric ward or to any other mental health facility, you are going there to be helped, and it doesn't mean that you are now mad. But it's because at that particular moment, as I said earlier, that we need an equilibrium and a balance in our lives. So whenever there's a tilt, then we suffer from mental issues. So you can help the person by being a good listener to the person, and also not treating that person as if now she has got a low IQ or something, because this person was having a challenge at that particular moment, but now the person has stabilized. So this stigma that whenever a person goes for counseling or for going to a mental hospital or psychiatry for consultation, then the people treat that person as if now this person is no longer a normal human being. I don't know if I've answered.
You know, I think you have answered the question. And I wish this can be normalized, you know, especially in the early stages of schooling, that there's such a thing as counseling. And like you're saying, it's a stigma that needs to be broken. But another thing that comes to my mind is affordability. Because when somebody is depressed or is stressing about financial issues, now thinking about going to a counselor and they need to pay the counselor is another financial burden. So is counseling expensive, or does it matter where you go?
It depends, because
How
if you
can
are
you
going
help on
to a
that?
private counselor like myself, of course it will be expensive. But at the same time, the hospitals have got those facilities, and also there's also Lifeline, which is a free phone call where a lot of psychologists are registered there. So when you call with whatever problem that you have, they'll be able to refer you to a counselor. Those counselors are free, and the numbers that I've given you, most of them are free. So when you call they will be
Yes.
able to take you to a counselor that is under government counsellors that are paid by the government that will be able to help you.
All right. So here are the numbers if you want to write them down. The lifeline that you can call is 011 728 1331. 011 728 1331. And this is SADC, South African Depression and Anxiety. Their SMS is 31393. 31393. Then you can send an SMS there. Or another SMS number is 32312. Now here's my question, Sister. This SMS, what do you write on the SMS? Do you write the issue that you have and send it to this number? Or you just write, please call me or something?
I
what do
need
you type?
counseling because of ABC. Whatever. I need counseling because I've been sexual assaulted. Or I need counseling because I have domestic violence or gender-based violence or whatever. You just write briefly so that at least they know how to refer you. Yes.
Okay, so then they will call you back. Okay, all right. And another number to call is 0800 21 223. 0800 212 223. Or 0800 7080 90. 0800 7080 90. And the suicide helpline is 0800 567 567. 0800 567 567. So I'll share these numbers on the chats on Telegram, and also on the recorded, I'll also share it on screen so that you're able to write the numbers down. But thank you so much, Sister. We really enjoyed.
Thank you for all the participants.
And that music says to us, we have come to the end of the show. You know, time flies. I mean, we still have so much to talk about regarding depression, trauma, and you being a counselor, how you can assist. But how can people reach you? Do you have a practice that they can come to, or they have to call you online? How can they reach you?
I have a practice at Midrand, at Blue Hills Mall. There's a medical center there.
Okay.
At Blue Hills. I'm available on Mondays and Thursdays.
Okay. All right. So we also share those details. And are you sharing your personal number or office number?
Yes, you can share my personal number.
Okay. We'll also share that one too. So thank you so much for coming to our show and explaining that. Maybe as a closing remark, anything that you would like to advise to our audience there?
I would advise them to take care of their mental health and not to see it as a stigma, because everyone experiences challenges in life, because life can throw curveballs on us, all of us. So when you are not dealing well with yourself, you must take care of your mental health, because it's important for you to function and for you to work normally. Thank you so much for having me.
Thank you so much. We want to thank everyone that have sent their questions on the chat on Riverside. We do have a show like this one every Monday at 6:30, and we also have another segment that we throw in every now and then. It's a book review. So if you know anyone who's an author and they would like to have their book reviewed, please contact us, and then we'll get in touch with them. We also thank you, those that have connected on Telegram. We had a good number today coming in, and we thank you very much. The comments also, we really enjoyed them. We hope that this session has really helped you a lot, and we're going to share the numbers with you so that if you need further help, then you can contact her, or you can contact those numbers that I've shared during the show. My name is Morapedi, the host of NMP Talk Show, and this is how we're signing out. You need internet, you need physical.